Watching breakfast television on City TV, how can we help ourselves get through losing that hour of sleep this weekend? We're wrapping up Sleep Week with sleep expert Dr. Charles Samuels. Dr. Samuels is the medical director for the Center for Sleep and Human Performance, also the president of the Canadian Sleep Society. Dr. Samuels, thank you for coming in.
My pleasure.
A whole week dedicated to sleep, and I have a question right off the top. So losing the 1 hour of sleep this weekend, is it really that big of a deal?
So there are two ways to look at that. So my first response to that is no. 1 hour in the whole context of things is not a big deal. But in our lives as North Americans, where we really run around with about a 10-hour sleep debt per week, losing that extra hour can actually have a significant impact on the Monday morning after the time change.
Ah, okay.
So in general, we would say if you're well rested, no, it probably shouldn't be a big deal. But because most of us aren't well rested and we don't attend to getting our rest and sleep, can become a big deal for some people on that commute to work on Monday morning.
Okay, how can I prepare for it then? How can I help absorb that lost 1 hour of sleep?
So there are two things that I always say is, one, the week leading into the time change, make sure you get your sleep. So if you're a person who knows you need 7 to 8 hours, you really should get that, which again we don't do because of our work schedules and our children and all the things that we do during the week. We tend to sort of push sleep aside, which we shouldn't do. And then on that weekend, the weekend coming up, we really shouldn't party heavily.
Okay.
It's the weekend where we should try and just get our rest and extra sleep to allow us to enter into the next week, not again further sleep deprived.
Okay, so resting leading up to it, and if we haven't done that yet, then of course just take it easy.
On the
take
weekend.
it easy this weekend and kind of just absorb it and deal with it. On a bigger perspective, how would a person know that you have an issue when it comes to sleep? What are some of the signs?
So there are two things that you have to look at. If you sleep and you have the experience of sleeping but wake up unrested most days, there's probably something wrong with your sleep. It's not restorative. The other is, and more common, would be that people actually recognize they don't sleep well. They have trouble falling asleep, and if they don't have trouble falling asleep, they wake up a lot during the night and have trouble getting back to sleep. Those are signs that there's something wrong with their sleep, and we would say if it affects their daytime functioning, which often it does, they're more irritable, they have poor concentration, less patience, then really they should be seeing their primary care provider to get help for that.
Yeah, okay. Yeah. And what are some of the things that I could do if I do find, if I do discover after tracking my sleep that I am waking up frequently or I'm having trouble staying asleep?
Yeah, I think that, people will go to the pharmacy and get sleep aids, which we would argue is a really bad idea.
Okay.
So over-the-counter sleep aids we do not promote, and that's me as a chairman of the Canadian group that's looking after guidelines for insomnia. We really discourage people going to the pharmacy and getting over-the-counter sleep aids. We would argue that they should learn about sleep. People go online, they learn about what's normal and not normal, and really going to your primary care provider, whoever that is, to get help and a proper assessment. Family doctors are trained to evaluate sleep disturbance now, which they weren't in my day 20 years ago. And they do have a good structured approach to determining what the best approach to treatment and intervention is. And again, we discourage the use of medication overall in treating sleep disturbance.
All right, all good advice. Take it easy this weekend. Don't do anything too crazy so you can absorb the 1 hour of sleep. Of course, setting our clocks back before you go to bed on Saturday night. Dr. Samuels, great advice. Thank you so much for coming in. Coming up on 8:27, around the corner, your news headlines, traffic updates. Andy's going to let us know how mild it's going to be this weekend. All